We've seen a steady increase in COVID cases in Oklahoma for the past 2 months. To find those positive cases, patients have to get a test first. Good evening, and thank you for joining us tonight. I'm Erin Christie.
And I'm Neely Jones. News Channel 8's Jamison Keefover visited a COVID testing site where they say they've seen triple the patients they did just earlier this year. Jamison?
Neely, Erin, they went from 100 tests a day to 400 tests a day at Access Healthcare's 5 locations. And other clinics are seeing the same rise. Now, instead of patients coming in out of precautions, they're showing up because they're already noticing symptoms. Staff at Access Healthcare in Bigsby are grabbing their tools, testing patients, and repeating the process dozens of times every day. On average, 350 patients show up for the nasal swab to determine if they have the virus or not.
We are doing more testing right now with this Delta variant than we were when COVID first started, and the numbers are increasing. We tested the most patients that we've ever tested. I think we tested over 400 patients yesterday. Before the Delta variant hit, we were probably doing less than 100.
They've seen a 300% increase in people coming for a test, and positivity rates have tripled.
We have seen exposure, but I would say the majority of the patients that we're testing right now are because they have some type of symptom.
They aren't the only location seeing this upward trend. Utica Park Clinic with Hillcrest Medical is also seeing people come in with symptoms instead of coming out of precaution.
Earlier in the summer, we saw a lot of people needing clearance for work, for travel, for different activities they wanted to do. And as the weeks have progressed, we've seen more people coming in for testing for actual symptoms.
Their efforts don't stop at testing, though. Staff members try to educate and treat patients for the virus.
Identify their symptoms early, get tested early so that they can get treatment sooner, and that way we can stay ahead of the disease before they get sick, where it's a lot harder to treat them.
There may be some things that we can do to treat the symptoms. We can help with the runny noses, we can help with congestion, and then we can educate the patients on the process so they kind of know what to expect as they're going through this.
This hopefully keeps patients from ending up in the hospital and helping them feel better quicker. They both told me there's a mix of age groups showing up, but there tends to be more middle-aged to younger Oklahomans getting a test. At Utica Park Clinic, last week's oldest positive test was a 94-year-old, and the youngest was just 8 months old. In the newsroom, Jamison Keefover, News Channel 8.